So what if an AI on your wrist could actually analyze your data and maybe suggest ways to boost your mood?
Yeah, I mean, that's the exciting promise, isn't it, with these digital mental health tools?
Exactly. And today we're taking a deep dive into, well, it's an observational study of a real digital mental health trial. We're looking at how machine learning systems, wearable devices, and that human interaction element, how they really come together.
Right, how they actually shape these personalized wellness plans in practice.
Our mission today really is to unpack not just how these systems are supposed to work, on paper,
Hmm.
what actually happens when they meet real life.
And you might find some pretty surprising things about the tech, personal responsibility, and like you said, that often unseen human element. It's fascinating stuff.
Okay, so let's start with the sort of the grand vision, the ideal picture, empowered patients, smart algorithms.
Right, the basic setup is that these digital psychiatry systems, they collect data from your smartwatch.
Like steps, sleep duration, that kind of thing.
Yeah, exactly. Steps, sleep, sometimes heart rate variability, and crucially, also your own self-reports on how you're feeling, your mood.
Got it.
Then machine learning crunches all that data. It looks for correlations, patterns.
And suggest things you could do differently, behavioral changes.
Precisely. Changes to potentially improve your mood based on your data patterns.
So what's the official story? How are these trials described formally?
Well, that's where it gets really interesting, I think. Formally, they talk about it in terms of two main pillars.
Okay.
On one side, you've got the intrinsically motivated, responsible participant, the person doing the work.
Right, taking charge of their health.
And on the other side, the empowering, insightful machine learning system, the helpful tech.
So it's this vision of like individual self-improvement driven purely by data insights.
And sociologists have put some labels on these ideas, haven't they?
Yeah.
Healthism and Techno-Solutionism.
That's right. Healthism is this focus, maybe even an overfocus, on individual responsibility for health. It's all on you.
And Techno-Solutionism is, well, it's the belief that technology is the primary or maybe even the only answer to complex problems like mental well-being.
And when you put this together,
You get what some call a neoliberal paradox. This idea that your personal freedom actually requires constant self-monitoring and self-discipline, often guided by technology. You're free because you meticulously manage yourself with data.
right, freedom through constant optimization.
Kind of. Yeah.
But okay, that's the formal description. What
Right.
about the human side, the people involved?
Yes. This is where the observation really brings things to light.
Yeah.
In the official accounts, the PWP guides, these are psychological well-being practitioners.
The people helping participants use the system.
Exactly. They help interpret the ML outputs, follow the
Yeah.
plans, but they're often described as just technical support.
Like IT help for your mental health app?
Almost. Or maybe even replaceable by a chatbot eventually. So it's definitely framed as not therapy.
But the study observed something different.
Completely different. These guides were doing crucial, invisible labor. Real, engaged listening, providing a sense of presence. It was essential care work, way beyond just explaining the data.
So they were bridging the gap between the algorithm and, well, messy human life.
Absolutely. Those gaps always appear when a neat algorithm meets the unpredictable reality of someone's day-to-day life.
Did you see examples of how the guides maybe struggled with this? Between the official role and what they were actually doing?
Yes, definitely.
Yeah.
There was this tension. For instance, a guide might try to stick to the script, the data-driven approach,
How so?
like trying to quantify subjective feelings, asking about mood, using numerical scales like gratuity levels was one term used, trying to make feelings fit the data model.
Trying to speak the algorithm's language, almost.
Sort of. Or they might gently steer a more personal, emotional conversation back towards the database handouts or the app's suggestions. It shows how that formal framing really does shape the interaction, even if it doesn't capture the full picture of the care being given.
That's really revealing. And it hints at potential disagreements, maybe even within the research team itself, between different perspectives.
Oh, absolutely. Even among the principal investigators, the PIs, there were different takes. You had, for instance, one PI who was very focused on the data-driven choices being the core mechanism.
Purely computational view.
Largely, yes. But then another PI considered the placebo effect, the idea that just believing the data was helpful could be motivating for participants. That belief itself had therapeutic value.
That sounds like a real clash between, say, a computational culture and a more traditional clinical culture.
Exactly. It's been called the AI chasm. This difference in perspective, sometimes boiling down to where you locate agency, is it the algorithm making the change or the person's belief in relationship with the guide?
So, pulling this all together, what are the bigger implications here? Downplaying the human element, these internal tensions. What does that mean for digital health overall?
Well, the risk is that it obscures the full complexity of what makes these interventions work or not work. It minimizes that vital human connection.
And maybe misses other important factors.
Precisely. It can lead to overlooking broader, structural things that deeply affect mental well-being, like someone's living situation, access to healthy food, maybe family stress, job security, things tech alone can't fix. It keeps framing mental health solely as an individual data-solvable problem.
So, the key takeaway from this deep dive seems to be that digital mental health is much more than just algorithms and individual willpower.
Definitely, it's this dynamic interplay, a real partnership, where human care and these subtle interactions are doing essential work, even if it's often unacknowledged or invisible.
Which leaves us with a really important thought to consider, doesn't it?
I think so. As we rely more and more on AI-driven health solutions, how do we need to evolve our understanding of care and agency?
Yeah, how do we make sure our definitions actually reflect the complex reality of these human technology partnerships?
Something we'll all need to think about. A lot to mull over there.